We've all heard stories about challenges consumers face when shopping for insurance coverage in the healthcare exchanges. The Partnership to Fight Chronic Disease, a coalition representing more than 100 different healthcare stakeholders, is focused on raising awareness of the human and economic toll of chronic disease and advocating for health reforms that lessen that burden. For all consumers, but particularly for people with chronic diseases, having good healthcare coverage is critically important. There are many questions consumers want to answer. Two basic ones are, can I keep my doctors, and are my medicines covered? To see what a consumer has to do to find out if her doctors are covered by a specific plan, we searched for health plans available in West Virginia. We used healthcare.gov for our search because West Virginia uses the Federal Healthcare Exchange. We narrowed the search to Charleston, zip code 25304, and entered an income of $51,000 a year. We identified ourselves as a 52-year-old non-smoker living in a single-person household. 14 health plans are available in that zip code, all from the same insurer. We narrowed that search down to just the 5 silver plans available, since silver plans have been the most popular with consumers. We took a look at the lowest premium silver plan to see how to find information about which doctors are covered under the plan. It was great to see links under each option for a provider directory, making it easy to start the search for doctors covered. The link took us to this website. We again entered our zip code, 25304, and selected a 10-mile radius to start the search for covered doctors. Since we weren't members of the health plan, we had to search by plan name to make sure we got the right network. We also had to answer a question about whether we had a community plan. We could not find that information in the plan name or the documents associated with the health plan. We also did not have a membership card, which is what the website suggested to find that answer. We selected no, that we did not have a community plan, then went to the drop-down menu to select our plan name. There were a lot of options, many with the same names, making it extremely confusing to know what to select, and most importantly, how that selection affected the results of the search. We knew from the name of the plan we were looking into a PPO plan, but the list offers 16 different PPO options, all with the same description. We tried the first name on the list and hit search. The search engine worked well once we found it, but given the challenges in making selections in terms of the plan we were researching, there was no way to know for certain if we were searching for providers using the correct network for the plan so that the providers we found actually accepted the policy we were researching. Another important question consumers want to answer is whether their medicines are covered. Let's look back at the lowest premium silver plan available to see what a consumer needs to do to find out what medicines are covered. Again, each plan has a direct link to a web page that provides access to the list of covered medicines, which is very helpful. This link took us to a new web page with a searchable database for covered medicines. First, though, we needed to determine which formulary the health plan uses. There were 3 formulary plans listed. 2 included the word progressive, and 1 was labeled comprehensive. Only 2 mentioned healthcare reform in the title, so we assumed these were the 2 available within the healthcare exchange. We followed the instructions on the page and followed the click here link to determine which formulary applied to this plan. This web page provided several options. Rechecking the health plan name for the plan we were researching, we discovered that we needed the Healthcare Reform Progressive Formulary. We went back to the drug formulary page and picked the Healthcare Reform Progressive Formulary to search. The page allowed us to type in a brand or generic name to search for medicines covered. The web page also listed the covered medicines by therapeutic categories. Looking at those therapeutic categories, you can see that many of the terms could be confusing to consumers. For example, not many cancer patients would know that anti-neoplastics are cancer medicines. Also, even within the therapeutic categories, it's confusing. For example, this link leads to two more, which only differ in whether they use an ampersand or the word and. Yet looking at them, you can see that different medicines are listed under each. The information provided includes a status column, which describes the tier for the medicine. The tier relates to how much the consumer will pay out of pocket for the medicine. You can find out the tier number on this website for a medicine, but to find out the out-of-pocket cost, the consumer has to go back to the Summary of Benefits document for the plan on the healthcare.gov website. To look at the Summary of Benefits document, we went back to the health plan and followed the link provided under the plan. The link took us to a page with a list of different summaries of health plans, including 6 different options for the silver plan we were researching. We opened each one of the 6 and compared the information to the cost information on healthcare.gov to discover that the first one on the list was the correct Summary of Benefits document. It's worth noting that there are not 6 different versions of this health plan even offered on the exchange. Though the formulary uses tiers to label the medicines in terms of out-of-pocket costs, the Summary of Benefits document does not. That makes determining out-of-pocket costs for medicines a challenge for consumers considering their options and the potential costs under each plan. Finding the correct link of covered medicines for the health plan is a challenge for consumers. Also, once the consumer finds the list of covered medicines, the terms used are not consumer-friendly, and those terms do not match with the information on costs in the Summary of Benefits document.